Hello, my name's Fiona Kennedy and I'm here to introduce you to DBT. So what is DBT? Can you see that? I hope you can see that there. Yes, what is DBT? DBT is a therapy designed for difficult to treat complex presentations. But actually it's fantastic for almost anything you're doing. And it's an evidence-based therapy. Which means that there is quite a lot of research supporting the fact that it works. And some other therapies don't work with very complicated, difficult to treat presentations and with motivational problems. So DBT spends a lot of time working on motivating the client, and it's a behavioural treatment. So it has a contextualist philosophical background, meaning that it sees reality as ever-changing and our perception of reality as the most important thing. So together, after working on commitment, the client and the therapist will draw up a list of things called target behaviours. So these are behaviours which ruin the person's life, threaten the person's life, and stop them getting help. Those are really specific behaviours, including self-harm, suicide attempts, etc. But also mental health issues like anxiety or depression, breakdowns of relationships with therapists for various reasons, etc. The other thing that will happen in DBT is that the client will be asked to join a group where they will learn skills to replace those behaviours that we're asking them to reduce. So in the group, usually, skills or replacement coping behaviours are learned. Now, of course, when you're working individually, you're also increasing skills. When you're working in a group, you're also decreasing unwanted behaviours. And sometimes if you can't join a group, the therapist might teach those skills independently, just you and them. So that's a very, very simple account of DBT. I should mention it also is very, very wrapped around mindfulness and balances acceptance and change. So as you see this seesaw on the bottom of the page, this is the biggest metaphor from DBT. And it makes the point that if we constantly ask for change, we're often sending a message to the client that you're not good enough. Whereas if we start with acceptance of the client, then we create an alliance and we create trust, and from that place we create willingness and we can work towards change together. So I hope that's helped you. There's lots and lots of other stuff around about DBT. Search for Marsha Linehan, Linehan on the net. I hope this has helped you, and talk again soon.